let's talk about the Mirena coil, which is amazing, by the way. It is a T-shaped device that stays in your womb. It can be used to treat heavy menstrual bleeding. For that, you leave it in for 5 years. It can be used as contraception. For that, you leave it in for 8 years. It can also form part of your hormone replacement therapy if you're going through menopause, and that can stay in for 5 years. It is very good, very easy to put in. I'll insert a video here on how it is inserted, and it's very easy. With the Mirena, what it does primarily is to thicken your cervical mucus, preventing the sperm from getting to the egg to fertilize it. Also, some people, it stops ovulation, which is absolutely safe. It is very effective. It has very limited side effects because it works locally just in your womb. So it is very important to ask your doctor what sort of coil you're having, because that's another thing I find, that some people have had contraceptive coiling, but they're not sure which one. So there's the hormonal and the non-hormonal. The non-hormonal coil is the copper coil. It's solely used for contraception. It can make your period heavier, so it's not recommended for anyone who already has heavy menstrual bleeding. However, the Mirena, the Kyleena, Jadis, those are the hormonal contraception coils. Okay, Mirena is the one which is recommended for heavy menstrual bleeding. Can also form part of your HRT. Whenever you're having your coil fitted, always ask for pain relief. Okay, something as little as a xylocaine spray on your cervix can really help numb the pain. So some of the other benefits of having the Mirena in is that you don't have to remember to take it like a pill that you have to remember every day to take. It stays in there, you don't have to think about it, and then when it's 5 or 8 years, depending on what you're using it for, you can ask for it to be removed. Also, it does not delay the return of fertility. So say you use the Mirena for contraception, whenever you have it removed, your fertility comes back, and if you want to have more children, you want to have children, you just go on and do that. It does not delay return of fertility, as opposed to the contraceptive injection, the Depo, that actually would delay return of fertility for about 12 months. Okay, so that's one of the important part of all the benefits of Mirena. If you have any questions regarding the Mirena coil or any of the hormonal coils, please let me know and we'll address it. Thank you. Alright, so I've made this video using my uterus model. This is how the Mirena is inserted. We visualize the cervix, then we measure the length of the uterus using a uterine sound. This is not uterine sound, I'm just improvising. We find the exact length of the uterus, and then we measure that against the Mirena. So we're able to fit the exact same Mirena length into your uterus to prevent perforation. We always advise that if you have severe pain, you shouldn't have severe pain. So if you do, you'll need to seek urgent medical help. So that's the Mirena going in. It should stay just within your uterus there, like so. And then we cut the thread at the end, okay? So not to worry, the thread would not interfere with anything. Some women want to feel the thread, so if you want to do that, you have to, bend on all fours, maybe in the bathroom, and then you put a finger up, and then you may be able to feel the thread.